Hello, and thank you for joining me. We're going to talk about something that a lot of men over 60 tend to keep to themselves, but it has a huge impact on your sleep, your freedom, and your day-to-day confidence. We're talking about prostate health. But listen, this isn't about just accepting discomfort as a normal part of getting older. Not at all. This is about giving you a clear, science-backed guide to taking back control. And you can start today.
So, here's the roadmap for our chat. First, we'll get right to the heart of what's really going on with the prostate. Then, we're going to walk through 5 simple but really powerful daily habits. We'll cover everything from how you drink water, to movement, to food, and even sleep. And then, we'll wrap it all up by putting these pieces together into your own personal blueprint for vitality. So, let's dive in.
All right, first things first, let's get to the root of the issue, because you have to understand what's happening inside your body to really fix it. Those frustrating trips to the bathroom in the middle of the night, or that constant feeling of pressure, well, they aren't just random. They have a very specific cause, and more importantly, it's a cause we can manage.
Now, the official medical term is benign prostatic hyperplasia, or BPH. Let's just break that down for a second. The most important word there is benign, and that means, thank goodness, that it is not cancer. But its effect on your daily life can be anything but harmless, and it is incredibly common. We're talking more than half of all men in their 60s, and that number jumps to nearly 80% for men over 70. So you are definitely not alone in this. This is just a perfect way to picture what's actually going on. I want you to imagine this. Think of your bladder as a simple water balloon. Now, the tube that lets the water out, that's your urethra, is like the straw. Your prostate, it's like a soft collar that's wrapped right around the base of that straw. And with BPH, that collar just slowly but surely begins to tighten its grip. It's that simple. So here's the most important takeaway, and I really want this to sink in. This is not your destiny. It's not something you just have to live with. Top urologists and major studies have all confirmed that your lifestyle patterns, the little things you do every day, play a huge role. You are absolutely not powerless in this situation. Okay, so let's get right into our first actionable habit. It's something we all do every single day, right? Drinking water. But what you're about to see is how the way you hydrate can either be a source of constant irritation for your prostate, or it can be a source of calm and real relief. Okay, so here's the problem in a nutshell. When we don't drink enough water throughout the day, our urine becomes really concentrated. It actually becomes more acidic. Now, that acidic fluid then washes over the very sensitive lining of your bladder and your prostate, and that causes inflammation. It's that inflammation that creates that constant, nagging urge to go to the bathroom. And the solution is amazingly simple. This isn't just a good idea, it's proven. A major study in the Journal of Urology found that men who simply changed how and when they drink their water saw up to a 41% drop in those nighttime bathroom trips. Just think about that for a second. A tiny adjustment for a massive improvement in your sleep. So, how do you do it? It's really just a simple 3-step rhythm. First, start your day with a big glass of water, even before your coffee. Get things flushing. Second, sip steadily all day long. The key is to sip, not chug. And third, and this is absolutely crucial, start to taper off your fluids and stop any heavy drinking about 2 hours before you plan to go to sleep. Now, on to our second habit, which is all about gentle movement. You've probably heard a million times that exercise is good for you, but you might not realize that a simple, perfectly timed walk can act like a kind of targeted physical therapy for your entire pelvic area. And just take a look at these numbers. This isn't guesswork. A study from the University of Sao Paulo found that men who took just a 10 to 15-minute light walk after their mean meals had a 35% lower risk of developing serious prostate symptoms down the line. We're not talking about running a marathon here. It's these small, consistent actions that have this huge protective effect. So why does this work? The science is pretty fascinating. You see, after you eat, your body is focused on digestion, so blood flow to the pelvic area can get a little sluggish. But when you take that gentle walk, it acts like a pump. It actively pushes fresh, oxygen-rich blood into the prostate and bladder tissues. And this does 2 amazing things. It reduces inflammation, and it helps stabilize your blood sugar. Okay, our third habit. This one deals with a very fundamental biological function of the prostate gland itself. Now, I know it can be a sensitive topic to discuss, but understanding it from a purely clinical, health-focused perspective is absolutely crucial for your long-term prostate health. This analogy really explains it perfectly. The prostate is designed to produce and release fluid. That's its job. So when that process doesn't happen regularly, the fluid could become stagnant. I want you to think of a garden hose left full of water out in the sun for weeks. Gunk starts to build up, right? And pressure increases. Well, the exact same principle can apply inside the prostate, and that can lead to inflammation and congestion.
And the science on this is incredibly strong. A major, long-term Harvard study followed thousands of men, and they found a direct connection. The men who maintained this natural function regularly, which the study defined as about 21 times per month, either with a partner or solo, had a staggering 33% lower lifetime risk of prostate cancer. Now, to be perfectly clear, this is about biological function, not performance. It's simply the body's natural, built-in cleansing mechanism.
Let's move on to our final two habits. And honestly, these are the foundation for everything else we've talked about. What you use to fuel your body every day and how you allow it to repair itself every night. Well, that can either dramatically help your prostate or harm it. What you eat has a direct and immediate impact. On the left, we have the good guys, protective, anti-inflammatory foods. Things like cooked tomatoes, which are packed with an antioxidant called lycopene, or pumpkin seeds, which are full of zinc, a mineral that is absolutely essential for prostate health. And on the right, well, we have the inflammatory triggers to avoid as much as possible. Things like processed meats, sugary junk food, and heavy fried foods that can really make symptoms worse. But even the perfect diet needs a repair cycle. And that's where sleep comes in. This chart shows a really stark reality from a major study. Just look at the bar on the right. It shows that poor sleepers had twice the risk of aggressive prostate disease compared to the sound sleepers on the left. You see, sleep isn't a luxury. It is the critical time when your body is producing natural anti-inflammatory compounds that protect and rebuild your body's tissues. So protecting your sleep is protecting your prostate. And the steps are pretty simple. You want to make your bedroom like a cave, dark, quiet, and cool. Stop having caffeine or big meals for at least a few hours before bed. And this is a big one. Turn off those bright screens, your phone, your tablet, the TV, at least an hour before sleep. That blue light really messes with your body's natural sleep hormone.
Well, we have covered a lot of ground today. So now, let's pull all these 5 powerful habits together. Let's build a single, cohesive blueprint that you can use to take immediate, effective control of your health and your comfort for the long haul.
So here it is, your blueprint, all in one place. Strategic hydration, to flush your system and keep it calm. Post-meal walks, to boost that critical pelvic circulation. Regular release, to maintain the gland's natural function. Strategic eating, to fight inflammation from the inside out. And deep sleep, for that essential nightly repair. Now, each one of these is powerful on its own, but when you do them together, they create this incredible, comprehensive shield for your health.
And at the end of the day, what this is all really about isn't chasing youth or trying to live forever. It's about living well. It's about being able to sleep through the night again. It's about traveling without having to worry about where the next rest stop is. It's about feeling a sense of energy and confidence. So please, remember, your prostate does not have to control your life. You do. And so I want to leave you with this one question, just for you to think about. After everything we've talked about, what is the one small step you can commit to taking tonight? Maybe it's just tapering your water intake before bed, or maybe it's taking a short walk after dinner. The journey always begins not with knowing all this stuff, but with doing one small thing. Thank you so much for your time today.